Welcome, everybody. Thank you so much for coming today to our July Educational Forum meeting. Today, we are thrilled to be joined with Amanda Dow. Forgive me if I mispronounce your name, and Dr. Nina Joan Terrell. And forgive me if I mispronounce your name as well. Um, Today's discussion is going to be on um, data centers. And we're going to hear from our speakers. Amanda will be speaking at the federal level, giving a broad overview on data centers, the health implications, and implications to nursing practice. And then we will hear from Nina on state-specific work that she has been doing in Pennsylvania. And forgive me, I am desperately searching for my speakers' bios, which I know I had a second ago, and I really want to make sure to share with you all because they are impressive. Sarah, do you mind resending that to me
Sure, I actually just put it in your GChat.
in my GChat?
Mhm.
Well, look at the tech issues I'm having today. Oh, 1 second, please. El Nino is playing with me. Okay, here we go. Thank you. Amanda Dell. We are very lucky to have Amanda. She is a registered nurse with her Bachelor's of Science degree, and she is an intern here at Annie with Chamberlain College of Nursing, pursuing her MSN with a concentration in healthcare policy. Her nursing expertise is in oncology, home infusion, and utilization management. She knows the disproportionate effects of climate change on vulnerable populations firsthand. When Hurricane Melissa destroyed Jamaica, and she advocated for her family via email to government officials, please mute yourself if you're not already muted, to government officials to ensure they received basic human necessities like food, water, and sanitation. Currently, she is working with Annie to complete a practicum project on data centers, which you will hear much more about in a little bit. And then we are also thrilled to be joined by Dr. Nina John Trerell. She is a doctorally prepared nurse and is Annie's Pennsylvania Nurse Advocacy Coordinator. Her work focuses on coordinating activities around climate and health policy, including implementation of the Inflation Reduction Act and the Infrastructure and Jobs Act in Pennsylvania. Nina is a dedicated educator and has lectured and conducted research on climate and sustainability topics. She is a registered nurse and has experience in home health, oncology transplant, and maternal child health nursing. She holds a BSN and a PhD from the University of Pennsylvania. Thank you so much to both of you for joining us today and sharing your expertise. I am going to be sharing my screen for Amanda's part of the presentation. So give me just 1 second as I battle technology. And please let me know that you can see this, and I will get that into presenter's mode. Full. Okay. Yay.
Yes, I can see.
Perfect. Thank you, Amanda. Take it away.
Okay, hello everyone. My name is Amanda Dow, and I'm a registered nurse. And as Millie told you, I attend Chamberlain College of Nursing for my master's, and I'm working with Annie on my practicum project. So today we're going to talk about the intersection of hyperscale data centers, public health, and the nurses' call to action. So the rapid rise of hyperscale data centers poses a threat to public health, especially for members of communities who live near these data centers. The Trump administration's Environmental Protection Agency rollback actually weakens the protection from climate pollutants, and it results in less oversight and increased greenhouse gas emissions from these data centers. Many of the hyperscale data centers, they repeat the pattern of environmental racism that has subjected communities of color to unequal environmental burdens. Next slide. So the learning objectives are to outline and explain the current scope of data center development nationally, list and describe 3 ways that data centers can directly impact local community health, and to discuss at least 2 actionable steps that nurses can take to advance solutions and address pollution and potential health impacts as it relates to data centers in local communities. What is a data center? So data centers, they are physical locations that house the routers, switches, firewalls, storage systems, servers, cooling systems, ventilation, and backup diesel generators for 24/7 continuous operations and network connections. Data centers support the apps, data, anything that occurs online in the cloud, pictures, medical information, financial information, government operations, and internet services. Some data centers even have break rooms and lounges for their employees. So there are traditional data centers and there are hyperscale data centers. So I'm going to tell you the difference between the two, but today we're focused on the hyperscale data centers, and you'll see why. So traditional data centers, they've been around since the 1940s. They account for only about 2% of the electricity usage, according to the US Department of Energy. They use about 0 to 10 megawatts air to cool down the system. The hyperscale data centers, on the other hand, one hyperscale data center can use as much electricity as 80,000 households. 100 to 999 megawatts of energy is needed, and mega campuses can use greater than 1,000 megawatts. The hyperscale data centers, they require water to cool down, and most often they're owned by hyperscaler tech companies like Google, Meta, Amazon, Apple, and Microsoft. Next slide, please.
Oh, I thought this, you want okay.
Sorry.
Should I go back?
No, you should go forward.
Okay. I'm going forward, but I think I should go back.
Okay, go back then.
I think this is where we were at.
Yes, thank you. So the overview of the issue. So the United States has the most data centers globally, with Virginia's Data Center Alley being home to a majority of the data centers. And despite AI and the data center infrastructure being considered like essential, they lack the necessary regulations.
Sorry, apologies.
You can go back. Okay. They lack the necessary regulation, transparency, and oversight, public information, reporting on the emissions and the health impacts. So the hyperscale data centers are emerging all over the United States, and it raises great concerns about the environmental footprint because of their heavy water and electricity demands, and there's a lack of transparency. Next slide.
I think
So currently there's an AI surge, AI boom, and data center expansion. So there is an immense rise in the construction of data centers, and it's mainly because of global competition. Tech industries are projected to invest $1 trillion into the expansion of AI by 2028. And this expansion, the rapid expansion, has outperformed the grid development. So basically, they're not able to keep up with the development of the energy infrastructure, and it takes about 7 to 9 years to complete. So to meet the electrical energy demands of America's digital economy over the next 10 years, there have been talks about nuclear energy being a potential source. The electricity demands of hyperscale data centers are that they use 10 to 40 times more electricity than the traditional data centers. The added stress to the electric grid causes them to be classified as large load customers, and the utility prices often rise, and those prices are placed upon the members of the community. Cooling systems are also required, and they release the thermal pollution into the environment. This contributes to rising temperatures, causing climate warming. So the health impacts from this include heat stress, increased mortality and morbidity related to heat, sleep deprivation, ischemic heart disease, cerebrovascular disease, and cardiopulmonary diseases. Air pollution is another important factor. So by 2030, the hyperscale data centers in the United States could cause about 600,000 asthma cases and 1,300 deaths prematurely. Research shows that the internet use produces 28 grams to 63 grams of carbon dioxide per gigabyte transmitted. The pollutants included with the hyperscale data centers are nitrous oxide from the gas turbines, methane gas, fine particulate matter, and diesel exhaust. The diesel generators release additional pollutants and toxins, and the diesel generators are backups. So what makes the hyperscale data centers so dangerous is that they cannot have any downtime. They are required to be operating continuously. So in the event that there is a power outage, the diesel generators will kick in, and that will release additional pollutants and toxins into the air. So the health impacts include asthma, cancer, and heart attacks. Water consumption is another concern. So 97% of hyperscale data center water use comes from municipal drinking water systems. So that means the same place that we get our drinking water from, the data centers are using this. Water is used for cooling and electricity production. 20% of data centers operate in water-stressed regions, and water stress is highest in small and medium-sized cities. Hyperscale data centers use about 5 million gallons of water per day. A lot of the water is chemically treated and is not suitable for us to drink or for agricultural purposes. And the health impacts from the water use is that we could be exposed to chemicals that we're unaware of. So decreased water quality, water scarcity from the large consumption of water, as well as dehydration and poor hygiene. Another concern is noise pollution. So the cooling systems and diesel generators, residents who live nearby hyperscale data centers are complaining of a constant low frequency humming sound. So indoor noise levels can reach about 96 decibels, but the National Institute of Safety and Health limit is 85 decibels over 8 hours. So health impacts from noise pollution include sleep disruption, cognitive and learning impairments, high blood pressure, cardiovascular disease, mental health effects, as well as headaches. Land use. Land availability and cost is priority when selecting land for hyperscale data centers. So hyperscalers, they prefer sites that already have infrastructure like roads, bridges, electricity, water, sewer, and the telecommunication fibers. So the suburbs and rural land is prime for them because they want to go where there's less conflict and where the land is cheaper and where climates are cooler and more water is available. This decreases the availability of land for agricultural use, and it takes resources away from the development of affordable housing. The health and environmental impacts of land use include deforestation from the removal of the trees to build these massive data centers on the lands, and this can result in large amounts of carbon dioxide emitted into the atmosphere and just increasing greenhouse gases. Food scarcity is also another factor, and that's from the reduction in the agriculture use. The disparity of hyperscale data centers. So hyperscale data centers, they receive tax breaks and incentives while tapping into our community grids. And us, the residents, we end up paying the utility costs while they're receiving incentives. Hyperscale data centers also pollute nearby neighborhoods and they use energy grids. But even though they could be using your community energy grid, but the data center is supporting data in another state or another country. And when it's in another country, the data center usually has fiber optic cables that runs into the ocean seabeds. So these massive campuses may have as few as 12 employees, but they may not bring jobs to your communities. A lot of times they contract. And for a data center that may be 12,000 acres, 12 employees is not really bringing economic opportunities to the community. Studies show that data centers create 100 times fewer job opportunities than any other industry. Another disparity is that each state has different zoning laws and rules. So while one state may get a ban on a data center, another state may not be able to do that based on the laws and the rules of that state. Next slide. So environmental racism in data centers. Research suggests communities within 1 mile of hyperscale data centers are disproportionately communities of color, and they experience higher levels of particulate matter, nitrous oxide, and diesel-related pollution. The rapid rise of hyperscale data centers introduces new environmental risks that disproportionately affect these same communities. Long-standing patterns of environmental injustice in these communities creates mistrust around hyperscale data centers. So the first case study we have is Louisiana's Cancer Alley. So this is a 130-mile industrial stretch along the Mississippi River between Baton Rouge and New Orleans. More than 200 industrial facilities are along this stretch, and they emit greater than 5 tons per year of petrochemicals. Minimal data is available about the air quality and health outcomes, and the lawmakers in Louisiana minimize the situation and say they need more evidence. Black residents are exposed to 60% more particulate matter in Louisiana, and according to the Environmental Protection Agency, more toxic industrial waste are released into Louisiana than any other state. Although it's not part of Cancer Alley, Meta built a 3,500-acre, $10 billion mega campus called Hyperion Data Center Project, and is powered by methane gas plants. Studies also show that communities within a 1-mile radius, including the Rayville and Delhi, predominantly Black communities. So they're within 1-mile radius of this new data center that Meta built. Next slide. The next case study is on South Carolina's Ace Basin. The Ace Basin is a conversion of the Ashepoo, Combahee, and South Edisto rivers. It is the largest undeveloped 1.6 million acre protected wetland ecosystem in the United States. It serves as a national wildlife reserve, an important habitat for waterfowl, migratory birds, endangered species, and 33 types of natural plant communities. Significant for rice plantations, and Harriet Tubman traveled the Combahee River and rescued approximately 750 slaves during the Civil War. In the same county, which is a predominantly Black community, a former coal-fired plant site that was linked to poor health outcomes closed down, and now the state is proposing a $5 billion gas-fired hyperscale data center, which is the size of 1,200 football fields, to replace the woods and wetlands. And it is said that the only reason why they came there is because they went to a nearby predominantly white community and they fought, so they weren't able to place a data center there. Next slide. So we have a case study about Memphis and South Haven. So Memphis has a history with the Memphis Defense Depot. It was a 640-acre military supply facility with chemical warfare agents and deadly cancers affected members of a nearby 100% Black community from toxins in the soil seeping into the water supply. Elon Musk is developing a $20 billion hyperscale data center in the South Haven, Mississippi area, and it will operate next to the Elon Musk Colossus hyperscale data center on the state line in Boxtown, Memphis, another predominantly Black neighborhood. These data centers use methane turbine gas without proper permits, and residents reported odors, sulfur smells, and severe respiratory impacts. Legal action has been taken. Next slide. The last case study I have is from Prince George County, Maryland. Prince George County, Maryland is deeply rooted and has a history of racial inequality. It's known for tobacco farming during slavery and the highest number of slaves in Maryland. They are also known for the House of Reformation for Colored Boys, and there's a history of racially segregated housing covenants. There were 2 proposed hyperscale data centers in Prince George's County, and the council passed a 2-year moratorium ban on all new hyperscale data centers. Federal policy. Hyperscale data centers are really hard to regulate as many states handle legislation at the state level, and the federal guidelines do not support the data centers. The Federal Data Center Enhancement Act offers data center guidelines, but the government is planning to let it expire. Next slide. Nursing implications. So for nurses, there's to elevate our concerns. As I said before, with states, the laws are really different, and some states may get moratoriums and bans while other states, the laws don't support that. So a national data center moratorium, just to pause data centers just until we have more evidence about how it impacts the public. We should also incorporate environmental health assessments in our current nursing practices, especially in vulnerable populations where patients present with asthma, stress, and heat-related illnesses and sleep disruptions. We should be advocating for nursing schools to incorporate climate change into nursing curriculums using the Planetary Health Education Framework. We should also advocate for data center transparency regarding water usage, emissions, and the noise levels. In conclusion, nurses serve as the bridge between the public and lawmakers. We must continue to be the voice for vulnerable populations, strengthen collaborations with policy and lawmakers, and further planetary health through the dissemination of information as it relates to health. Hyperscale data centers without rules and regulations and transparency, it poses a huge threat to human health, environmental health, and our basic needs to support life. We must advocate and be the translators for how big tech impacts our planet and our health. Thank you so much for allowing me this opportunity to speak. And right now, my colleague, Nina Junteril, she's going to talk about data centers in Pennsylvania.
Wonderful work. Thank you so much, Amanda. Please give me
Thank
one
you.
moment as I share my slides. Can you all see my slides?
Yes.
Yes.
Okay, perfect. All right. So thanks so much for taking time out of your day to be with us. I'm very excited to speak with you all. My name is Nina Genturial. I am the Pennsylvania Nurse Advocacy Coordinator with the Alliance of Nurses for Healthy Environments. I'm here today to discuss this hot topic and to complement Amanda's presentation, who spoke more broadly on the national front, as well as now what happens and operationalizes more at the state level. And I'll be doing specifically looking at it in the state of Pennsylvania, where I live and work. So before I begin, I'd like to just first acknowledge that I'm coming into this meeting sitting on the indigenous territory known as the Lenape-Hawking. The descendants of the Lenni Lenape are the traditional owners of the lands in which I live and work. I also want to share I have no competing or conflicting interests, and that all materials and images as part of this presentation are used as part of various principles for education purposes. So let me see if I can turn my slide. Oh, 1 second. It's not moving. Oh, perfect. So my learning objective is to recognize how data center expansion in Pennsylvania impacts affordability, grid reliability, and public health. So a bit of background before I get into data centers. I do want to acknowledge that Pennsylvania was the first state in the US to embed environmental protection in the state constitution. So this amendment makes the Commonwealth a trustee of public natural resources, meaning here in our state government, the regulatory agencies like the Department of Environmental Protection, they have a constitutional obligation to conserve and maintain the natural resources of our state for the benefit of current and future generations. So this right again gives Pennsylvania residents that legal foundation to hold our government accountable in the state when to protecting our air, our air and water quality, as well as requiring these decision makers to consider these rights when making their own policy choices. And I believe that while we are the first state. There are green amendments that were in place in New York and I believe Montana. So please on the lookout if you're interested in learning more. As I know those are on the horizon. Some are moving forward, some are in processing. Oh dear. So sorry. Let me stop my share. This is the wrong slide set. Oh, apologies for that. Perfect. Okay. So now let's look more specifically at the state of play on Pennsylvania in data centers. So right now you're looking at what is known as the trackdatacenters.com. From my survey of the field with a number of coalition members, this is probably the most comprehensive way to look at the active number of proposed data center projects at the state level. I'm showing you here the number of proposed projects in Pennsylvania, but this tracker can be used to identify the number of data centers that are being proposed in other states. Currently, we are at a total of 80 pre-application proposed projects, meaning projects that were being considered in the Commonwealth prior to regulations being put forth. And as you can see from the breakdown on the slide, the mass majority of these projects are really in this early, very flexible phase of development. The numbers are broken down for you, but to put this more in a summation, 72% of this entire pipeline really is again at the early stages. We're looking at 24% still in preliminary discussions, while 48% are actively proposed. Of these, 5% have been fully approved to move forward, and 6% have been actively constructed. And of these, 4 of them are hyperscale centers, which Amanda has talked about more detail about the differences. And again, talking about how they carry, again, the exponentially larger power load as well as the water footprint. Meanwhile, municipalities and locals have really put in resistance to these projects being proposed and developed, and have resulted in a combined projects of being whether delayed, withdrawn, or outright rejected. So again, there is opportunity for residents and local business to put their own say in how these projects are affecting the local land and natural resources around them. So with these projects currently in development, we are really at a critical crossroads because, again, the play of data centers is still ongoing. So with data centers, as mentioned a bit earlier about the grid, a major concern is how can they supply enough energy? So this is defined, again, having enough energy through a regional capacity. So again, I live in Pennsylvania, and with Pennsylvania, our regional organization that offers this electrical capacity or grid is PJM. It does not generate the electricity itself. PJM is more like a coordinator or operator. It coordinates how electricity is produced by power plants. Then they transmit it through the high voltage lines that we see when we're outside, and then delivered locally to the utility companies. And the utility companies are the ones who then redistribute it to homes, hospitals, and local businesses. So there's a wholesale market, and this is where power plants then compete to just sell their electricity broadly to PJM. So then that is then referred to as capacity. So that is having enough power available to then have electricity to meet future demands, especially when we are experiencing the extreme heat or cold temperatures. So the retail market is where we kind of see it more likely. It's where consumers see those utility bills, and where local utilities also pass along the costs that they've provided from purchasing that electricity, and as well as the cost that we pay to help support the future demand of electricity. So one of the most significant drivers of rising electricity costs in Pennsylvania is, again, the rapid growth and increase in data centers. And this is reflected from PJM's capacity auction results. So you can see during the wholesale market from 2025 to 2026, there is nearly a tenfold increase. It went from $28.90 megawatts per deciliter to $269.92 megawatts per deciliter. So again, these capacity auctions are really designed to ensure that there is enough power to supply future energy demand. But when that demand grows higher than the supply, the price will just rise dramatically. So according to an independent agency, Monitoring Analytics, there's been about a 63% price spike, and that has been attributed predominantly from data centers. So as we think about data centers and the rollout of AI capacity, this puts a lot of pressure on grid planning and the amount of energy the grid can support to meet this demand. So in Pennsylvania, we have more than 30 utility companies. They're also known as electric distribution companies. They are required as part of the regulatory landscape to submit forecasts to PJM, basically sharing how much electricity they think they'll need in the future based on the current demands of what's going on now. So this helps with future planning and for long-term energy security. So while utilities are the primary infrastructure, they often propose, because of these higher demand forecasts, rate increases to really meet that, as well as to anticipate like infrastructure costs to meet that demand. And for that to happen, it has to go through what is known as a regulatory process. So in Pennsylvania, we have the Public Utility Commission. So they determine whether the costs that utilities are proposing are justified, and they should be distributed to ratepayers, meaning us as residents as well as other local businesses, because ultimately we share those costs. So ultimately, decisions made on these rate cases directly impact ratepayers, and this can influence electricity bills for the households and businesses again. Now we talk a bit more about some rate cases that have been going on in Pennsylvania and how this has been affecting the landscape on energy policy. So fortunately in Pennsylvania, we've had a number of rate cases. I'm going to highlight two, and one is currently in discussion. The first one is the PPL Electric Utilities rate case. This one has really set the precedent, especially for data centers in Pennsylvania. So in June 2026, the Public Utility Commission in Pennsylvania approved their rate case settlement. So this happened when PPL again introduced their rate increase in response to demand in response to the energy demand of data centers, but the Public Utility Commission then reviewed the case as well with support with public commentary and opportunity for the public to offer their own thoughts about that. Notably, we did have one nurse from Pennsylvania in our advocacy network who submitted formal comments as part of this docket, again, highlighting the importance of public health in these policy discussions, really showing that for this rate case and in how to define the settlement, the Public Utility Commission ultimately decided to create a distinct large load rate class, specifically for large load users like data centers. So it forces the developers now to become their own class to pay for their infrastructure requirements, as well as sign a 10-year commitment to guarantee that they pay for this infrastructure upfront. Another rate case that has been prominent in Pennsylvania has been the case with PECO. So in the southeast portion where I live, so Governor Shapiro actually directly intervened with this rate case. He demanded directly that PECO withdraw their rate hike, which would have added significant cost to ratepayers. I think it was about $20 or so more per month. And this direct intervention by the governor has then ultimately led to the withdrawal of PECO's rate case and rate hike spike. So again, looking at two different cases and how direct intervention by a governor, as well as ways in which the rate case played out with PPL, really shows that the importance of advocacy to directly confront the affordability crisis that's going on related to data centers. Right now, we also have UGI Utilities, another smaller utility company located in the central region of Pennsylvania. They have some active rate cases open and will continue to follow suit. We hope that the proceedings of this will match the PPL standard, and hopefully that will be applied uniformly across the state because, again, these rate cases are utility dependent. Pennsylvania is also leading the nation as well with operating a large load tariff. So this large load tariff is a regulatory framework that was devised by the Pennsylvania Public Utility Commission. It really overall prevents residential households and small businesses from subsidizing the infrastructure costs, again, of AI data centers. So in May 2026, the Public Utility Commission has finally passed this large load tariff model. It establishes what my colleagues in the law field say but-for standard, meaning that utility infrastructure upgrades wouldn't have been needed, but for solely the data center itself, meaning that private companies should pay 100% of those costs upfront. So again, this is a really strong step forward. The issue is that this is, again, just a framework guidance, meaning that individual utility companies do not necessarily have to formally adopt it. But this brings us to a critical time window because currently there is a public comment period open from now until June 24th. So if there are any residents in Pennsylvania who are interested in learning more, please let me know as we have an opportunity to participate and submit comments with the Pennsylvania PUC. So again, I urge you all to consider publicly weighing in your own states as these binding rules really set the statewide standard and can really strengthen protections for Pennsylvania customers and electric grid reliability. So going off of that, so Governor Shapiro also recently released the GRID standard. So the GRID framework, and this stands for Growing Responsibility with Infrastructure and Data, it redefines, again, state-level economic development. It mandates that developers of data centers who wish to qualify for these state tax incentives, they must actively mitigate their own burden to communities. So this compliance means that it must be enforced across the state, and it involves 4 key domains. So energy affordability, meaning eliminating rate increases for consumers, transparency and community engagement before the land is ultimately settled and zoned, as well as thinking about the workforce development as part of these build-outs, as well as the environmental protection to regulate water, energy, and localized emissions. So the urgency of this issue cannot be underscored and needs to be enforced through legislative action. So this standard was actually recently codified into a House Bill 2650 to put these standards into law and really transforming this guideline more into a compliance framework. And I'm incredibly proud that one of our co-sponsors who fought to pass this bill in the House was, and I want to highlight a good friend, Representative Tariq Khan, who is a nurse by background and understands, again, the public health impacts related to energy infrastructure. So highlighting a nurse on the forefront of co-sponsoring this important bill. I also want to highlight a few critical bills that are in the General Assembly in Pennsylvania that are moving as it relates to data center. So of these, I'm happy to talk more in depth about each of them, but for the purposes of highlighting a few that are key, I want to highlight House Bill 1834, House Bill 2496, and House Bill 2533. These according to my work with the coalition, as well as work with a number of colleagues in the law field, these are the key bills to act that will set the stage for fundamental protection. So House Bill 1834 establishes a strict utility firewall, meaning that tech developers will need to pay, again, the 100% grid upgrade costs upfront across, so not to shift these costs, again, to ratepayers who are used for the energy demand. House Bill 2496 and House Bill 2533 are similar in that they support a municipal moratorium, granting local governments, again, up to 180 days to really research and take a pause prior to further development and understanding of the land use and zoning laws for these data centers, and as well as like initiating more physical development. So as the General Assembly continues to debate about these measures and laws, two massive tension points I want to point out and reason why we're seeing some of the processing right now. It seems that municipalities are demanding to have their autonomy to protect their land at which they govern for that noise and water depletion, right? Because certain parts of the state are different than other parts. However, there is immense pressure to really think about it as a uniform statewide protection, so local zoning doesn't have to completely stall out the tech development. Another issue that's been in contention really has been thinking about, again, ratepayer protection at the state versus industry competitiveness. So again, we're nurses, right? So from a nursing and public health standpoint, we always think about how it would impact the burden of our communities as it relates to health, as well as the energy that insecurity that can come out because of the inflated electricity bills. But lawmakers are debating how to protect families while making Pennsylvania not so cost prohibitive that they consider losing out to other states on the AI investments on data center. So those are a few tension points to think about as these bills continue to move. So this was a bit more of a snapshot of what goes on in Pennsylvania, as well as the state level activity on data centers. I do encourage you all to learn more and get involved and see what's going on in your own state as it relates to data center activity. There are a number of tools to really track that rapid expansion, and I've listed a few of them here. So again, trackdatacenters.com, it really monitors proposals across each state. I've also added electricchoice.com. It really aggregates some state-based data on energy consumption of data centers and how it can affect resident electricity bills. There's also work being done by Climate Exchange, a research and nonprofit organization that maintains a dedicated state level legislative tracker. So you can actively catalog or receive their catalog of legislation across the country and per state on data centers, giving us, again, a direct window to how neighboring states can compare as it relates to data center and the AI boom. But again, tracking is just the first step. Again, I do encourage you all to actively participate where these decisions are being made, and urging you all, again, to prioritize health into these state conversations, in particular through the formal public comment period, as well as opportunities for testimony on the proceedings, whether that's on the sitting, zoning, or utility rate case discussions. During these testimonies, I suggest framing arguments around our unique lens on health and the clinical time point, focusing again how localized emissions and pollution can directly contribute to the environmental exposure we're seeing, and then the health hazard, highlighting how data center can contribute to that heat island effect and worsening extreme heat, as well as emphasizing again how unchecked strain on the grid can threaten continuous power and how that could affect the power supply for other local residents and businesses such as hospitals or even residents who require electricity support or life support for medical equipment for homebound patients. So I leave you with this final consider as well across the country. So last week, prior to the 4th of July holiday, we did have those who live on the East Coast an extreme heat event. So at the time, the Department of Energy has then invoked a federal emergency to prevent widespread blackouts because of the extreme heat we face. And to save the electric grid for PJM, the Department of Energy also authorized PJM to take last resort actions, meaning they forced large AI data centers of the public grid to use their backup generators to prevent the blackout. And second, completely waive environmental pollution limits so that power plants could run at maximum capacity, again, bypassing air quality risks. So from a clinical standpoint, this is a bit cautionary and worrying, as extreme heat already is already a health hazard, but the likelihood of prolonged heat exposure during as well as how are operating by emergency operating again. This emergency last week is really proof that we need to act to protect the grid, to protect our health before the next heat wave strikes. So thanks so much for listening. I look forward to our discussion.
Thank you. Thank you so much to both our speakers. That was a really both phenomenal presentations. We did have some questions, so I'm going to dive right in them. We're getting some claps. This one is for Amanda. And Amanda, if you need to circle back, just let us know. My email is always me and Hannah. You can always email us. This is from Peggy Ann. Barry, is there an estimate of water usage with hyperscale data centers? And I apologize to everybody. We're having a lot
They
of
found that about the water.
is there an
The hyperscale data centers. Can you hear me?
Perhaps, Amanda, we're having trouble hearing you. Perhaps, can you follow up that question in the chat and then
With the
we can move
hyperscale data
forward?
centers, they found that about 5 million gallons per day was used. But that's what the tech companies are reporting. And as I said before, there's little oversight and transparency. So we really don't know if that is accurate because there's also indirect water use and direct water use.
Gotcha.
So
Gotcha.
that's why regulation and oversight is important.
Perfect. Thank you so much. And that can be especially critical in areas that are prone to drought. Just interjecting a little bit there, but now we have the question from Emily Little. And again, feel free to circle back if you need to look the answer up. What percentage of energy do the hyperscale data centers use? Do we have like an idea of that percentage or range?
So AI data centers, from my
Well,
understanding.
I do know that at one data center, the Google data center, when they measured how much energy consumption, so 90%, 96% of the energy use was from the data center for that particular site. So 96% of the energy use came from the data center alone.
Okay. And Nina, did you have something to add on to that?
Yeah, again, so my frame is related to, according to the International Energy Agency, I think they say an AI data center can power up to 100,000 households. So think of that scale. Whether those AI data centers are hyperscale, unclear, but I hope that gives a bit more of that level of impact for folks.
That's perfect. That gives us a something that our minds can like picture. So thank you for that. We did have a more of a comment, I think. Oh no, another question, sorry, from Ava Smith. How can student nurses get more involved in environmental health nursing? You know what? I'm gonna save that phenomenal question for the end and just make sure that we get the data center questions answered. This next one is more of a commentary from Tom, who is on the line, Tom Engel. We know this, and I'm just going to sort of paraphrase it. We do know that the medical establishment actually does benefit from using data centers, and we do acknowledge support and the reliance, right, of modern healthcare on those centers and patients. So, for example, 3 million have pacemakers, and that those contraptions, those boxes that they have at home, communicate with the data center, right? Another million have internal defibrillators or electronic neural implants. Modern surgery suites and intensive care units use data centers as well. So I think Tom's point is we do have something called responsible use, right? And acknowledging the benefits, the very real benefits that we take advantage of from data centers for the health and wellness of our community members. But having acknowledged that, that comes with a responsibility. And going above that and beyond that, just for extraneous uses, and that's where we really begin to expand on the problem and the environmental health impacts. And so responsible use is really key, and we must acknowledge there is no going back, right? This is where we're at, and we have serious medical conditions that have now rely on these data centers. So we're looking at where we're at and how do we move forward from here with, again, that contextual frame of responsible use. Thank you, Tom. There's something about scope 3, but we'll leave that for another conversation. Other than that, does anyone else have any questions before I circle back to our student question? Any questions, any comments? The chat will be, the chat resources will be sent out to everyone, as well as the recording for replay. Apologies for all the tech issues we were having. El Nino, I'm just going to blame El Nino from now on. We applaud both our speakers. And then while we have just a few minutes left, I do want to go back to that really important question from Ava Smith. How can student nurses get more involved in environmental health nursing? Come on, Amanda. That one's for you.
I did ask Amanda to
I would
utilize.
say to join Annie.
To join Annie. Yes.
Yeah,
What? Yes.
I would say
Thank
to
you.
join Annie.
Good answer. Good answer.
Yeah.
Yeah. And Nina, anything to add on to that? Nina's frozen. I will say, as students, you have a voice to request, especially at the graduate level, courses or opportunities, educational opportunities around environmental health. I understand that undergraduate level, you're really working towards your NCLEX, but there are ways to incorporate at every stage some of those educational opportunities. And so please do advocate for that if that's something that you're interested in and that's a path that you would like to pursue in the future. And of course, as Amanda said, Annie is a wealth of opportunity and it's free to join us. All right. Any last comments, questions? Otherwise, thank you again for all your participation. This was a really engaged group. Oh, we do have a comment to answer from Anne Griebel, Dr. Anne Griebel Gasparro. As faculty, we can advocate for the inclusion of environmental issues into classes. That's really important. And also remember this for those of us who are certified, board certified. I myself did not have environmental health as part of my certification process as an adult nurse practitioner. But that option to include that information, what did lay with my instructor. And I, in turn, have offered that for other certifications in oncology when those professors have requested a guest speaker for a particular class that didn't play to that certification, but it is something that the students wanted and the instructor made time for. And so there is power in advocating as a student and saying, this is an interest of ours. So thank you. Thank you again. And with that, I'm going to stop the recording and wish you all have a great day. Thank you so much for joining us today.